Sorry about that.
So I think most of you recognize our IHS Pacific Governor, Don Tucker. We appreciate you joining us, as always, to give us an update from IHS on what's happening nationally. I think we're going to hear a little bit today again about OTC, other legislative updates, chapter affairs, all kinds of good news from around the country. So without further ado, I'll turn it over to you, Don, and
thanks
for joining us.
Thank you. So I'm down here in my office in Temecula, and I have to say that I was really looking forward to going up to Washington, Wenatchee, and just being with you guys. I just really enjoy you, and you guys have always been so welcoming to me when I first started as territory governor of IHS for the Pacific Territory. And it would have been really nice to see you guys again. But it's also nice that we have the ability to get together in this type of a format. And really, I'd like to personally thank Rick Giles and the Washington Hearing Society Board for allowing International Hearing Society to present at this summer conference and for all the hard work they have done to bring us together in this format. So you guys, give it up for Rick Giles and the Washington Hearing Society Board. You guys are awesome. Hey, I think you guys got a standing ovation. That was really nice. Also, please be sure to visit the Washington Hearing Society virtual auction at www.32auctions.com/WHS 2020. Now, some people may not realize the association between Washington Hearing Society and the International Hearing Society. We are affiliated through a chapter system. This means that this association is part of a network that includes 50 other organizations in the US and in Canada. And we work together to share trends, opportunities, and address challenges. And IHS works closely with its chapters on legislative and regulatory advocacy issues, and is the only organization working in Washington, DC on behalf of hearing aid dispensing professionals, and specifically hearing aid specialists. Now, pictured here are chapter leaders from across North America and Canada. I guess North America is Canada, right? It has Canada in it. Anyways, this is during the 2019 Chapter Leadership Conference, representing 34 IHS chapters in 36 states and provinces. And this was in Nashville, Tennessee. What a beautiful venue at the Opryland Hotel. That was incredible. Listed here are just a few reasons why you should be a part of why you should be a member of a professional association. And we'll discuss all of these items today. Since 1951, we continue to evolve to meet the needs of our members, set the standard for our profession through education and professional development materials, and participate with international work groups, and maintain a solid presence in the legislative and regulatory venues. As our industry evolves, so must we. Listed here are some areas IHS is strategically preparing for to keep you informed on how to survive and grow during these drastic changes in our industry. Give you a chance to read this screen. One of the things that I think is coming up is the delivery models expanding to include OTC and telehealth and big box drugstores, and then the rise in insurance coverage and discount plans. Oh my goodness, it's changed so much. Advocacy affects every aspect of the profession and hearing aid business. It includes federal policies that govern hearing aid sales, state policies that influence licensure, insurance, consumer protections, and so much more. It is making sure hearing aid specialists are heard, considered, and integrated into critical policymaking. IHS is the only organization at the federal level going to work for hearing aid specialists, and our voice is directly dependent upon the hearing aid dispensing professionals, you joining the organization and participating. Very important. Next, I will review some recent actions of importance to our members. And so if they're important to you too, you should consider joining IHS. There we go. IHS has some recent and great news, really good news to share with you. in this international, federal, and state policy report. And if you've been reading the communications IS sends to you, you might know some of these things that we're about to discuss. So if you get an email from IHS, please open it up and read it. There's been a lot of really helpful information. Now, over-the-counter hearing aids, here we go. We've heard about this for so long. We know about it. We've talked about it. And right now, it's all starting to come together. So let's just do a little bit of a recap. We know that over-the-counter hearing aids are to be used by adults with perceived mild to moderate hearing loss. Perceived. That's in the law, that language. And the device may use wireless technology, and the device is going to have user controls. They can set their own. It could be an app. It could be buttons. This is like a hearing aid. This is a real hearing aid. And over-the-counter, these over-the-counter devices, you can buy them over the counter. You can get them through the mail. You can get them online, and there's no intervention. You don't have to have any licensed professional for this type of a device. Now, the FDA's role in regulating these devices is to provide reasonable assurances. This was all part of that language in the law of the safety and effectiveness of the device, and establish output limits. This is a game. This is how high they go on the output. Addressing labeling concerns, those red flags, and then describe when OTC hearing aids may be sold without the involvement, of a licensed professional. Definitely not to children. So that's going to probably be part of the labeling. So what will the role of the states be? According to the law, states may not establish or apply any law, rule, or other requirement that would restrict or interfere with servicing, marketing, sale, dispensing, use, customer support, or distributing of OTC hearing aids. So this is really important, this preemption here. If you decide to add OTC to your practice, how do you plan to separate OTC federally regulated transactions from Washington Hearing and Speech Board regulated hearing aid transactions? So they have two different regulated devices here, and you have to separate them. To know how to do this, stay in tune with the Washington Hearing Society and with IHS. We do know that the FDA is no longer enforcing medical waivers for adults with no FDA red flags. When the final OTC regulations are issued, the FDA will have to update the regulatory requirements for hearing aid devices and personal sound amplification products. And what this will do is it'll clarify which products based on advertising claims and labeling are OTC or personal sound amplifiers. They have to differentiate. Now, again, we keep hearing about OTC. I mean, we keep reading about it in all our industry journals. And all we really want to know, we just really want to know, when are these things going to hit the market? Oh my gosh, it seems like it's going on forever, but it's given us time to prepare, right? Well, on your screen is a timeline, and let's sum up this timeline. Now, if the government can stick to a deadline, so actually, this is an interesting statement because this last week on August 18th was a deadline to release the proposed rules. And they're late. And we want to expand government, don't we? Now, we're going to stick to this deadline of August for the purpose of our clear timeline. And then after the rules, the proposed rules are released, then comes public comment on the proposed rules, which from this month would last from October to November. So it's 60 to 90 days. And then the final rule, after all the public comments on these OTC devices, will show up about 6 months later, which puts us at May to June. And then after the final rule, these devices will be manufactured according to the final rule. And it takes a little time, of course. So that's going to be around summertime. Think about this. Right around summertime of next year, this is when most of us will probably have fully recovered from this COVID stuff. And then OTC is going to hit the fan. It really is. And so we just have to be on our game. We really do. It's happening in a short period of time here. After the proposed OTC rules are released, the public comment period opens, and IHS knows the FDA reviews the comments, and IHS plans to respond and keep you in the know so that you may also respond, and we will all work together. And when you work together, this will get the FDA's attention. IHS also knows consumer electronic groups will be submitting comments as well. Now, one way we can be on our game is to be involved in the process. And IHS is preparing to help you with these comments. And you can learn more about this by visiting this website right there on your screen. All right, some good news. Everybody wants some good news? Come on, do this, do something. Give me a good news wave. You want some good news. I have good news. Thank you, Sandy. I have good news. Well, there's about to be good news served because with a Fit to Serve update. As you all remember, back in 2016, IHS accomplished one of the most amazing feats. We got a bill passed. This bill was to help alleviate the wait time for our veterans by utilizing the expertise of hearing aid specialists. The bill authorized, more likely mandated, that the VA hire hearing aid specialists, but the VA is not doing it. So last year, 2020, last year, 2019, was a really busy year for IHS, and it ended up leading to a major development in January 2020. Now, back in the glorious days, last March, just this last March, when many of us were in Coeur d'Alene together, and we discussed a lot of this stuff. I have some presentation, but we discussed a lot of this, and we discussed Senate Bill 785, and we focused on this little paragraph titled Section 703. If you remember, the Senate Bill 785 was this big, large bill covering veterans' mental health, and there's this paragraph, Section 703, that had language that was very specific language and mandates and directives about the VA hiring hearing aid specialists. And there was some accountability to Congress to see these directives that are followed. This bill, S785, with the amended Section 703, just passed unanimously out of the Senate on August 5th. Give it up for IHS. Woohoo! Yay! Hey, this is all the board of directors were given when the Fit to Serve bill passed. Can you guys see this thing? There you go. This is a kind of a triangular glass-shaped miniaturized version of the bill, and so all the language is on this thing, and it has it signed by the president and all the Senate speaker and the House speaker. So it's pretty cool. It's really cool. What a great thing. So now that IHS, or now that this bill is out of the Senate, IHS focuses on the House of Representatives, Bill HR 6612. Let's go to the next slide. Here's a summary of the language in both bills. Now, really, if you want to do this, look at that bill 785, S785, that's the Senate bill, and go to Section 703. It has more to do than just on the screen, but it's really a fun read. It's very strong language on the VA's directives on what they have to do. And here's just a couple of 3 bullets here, where within 180 days of the bill's enactment, establish qualifications for hearing aid specialists to work for the VA. And by September 30th, 2022, appoint at least 1 licensed hearing aid specialist at all VA medical centers and submit an annual report to Congress assessing the VA's progress in hiring hearing aid specialists, as well as any potential conflicts or obstacles affecting hiring. So our priorities moving forward, take a look at this screen. We want to pass the House bill now. That's what we're working on, of course, and working with the VA on technical qualifications for hearing aid specialists, and pursuing change to the audiology directive, which is under development, to lift restrictions on when hearing aid specialists can be contracted with. So instead of just hiring them at the VA, if you're in a remote area and there's not a VA very close for our veterans, you may be able to contract with the VA. And then that gets next to our next bullet, is pursuing ways to use the Mission Act, which is part of that, to deliver hearing aids through a contract network and make you included. So what can you do? The veteran call to action is a one-pager the provider should distribute to veterans. It aims to have veterans contact VA Secretary Robert Wilkie to share their experience trying to access VA care. So now please open your private chat and send these words to the moderator, okay? IHS totally rocks. IHS totally rocks. I give you a minute. Man, that's some good news. What I've been dying to bring you guys. Okay. You know, this whole COVID thing has just changed our lives. And have you noticed how many COVID-19 response communications we receive? You guys get a lot of those too in your email? I mean, our manufacturers we do business with, our suppliers, everybody else, you know, everybody, even people we don't do business with. I think that's their way of advertising is starting with a COVID response. We're all concerned about it, so we open it up, right? But it's the credit card companies, it's their response that actually stands out to me the most. And my interpretation of their response reads something like this. We care for you. To reduce your exposure to the coronavirus, please submit your payment by email, by electronically, online. That's their response. They care for us. They just want us to send our payments to them online. It's just nuts. But IHS has a COVID resource center. The website is on your screen, and it's a really good website. It actually has useful information for you. And get this, in the thick of it all, on the same day CARES Act was passed, IHS Executive Director Kathleen Manello, in a video on IHS's Facebook page, gave explicit directions on how to take advantage of the newly passed CARES Act. And as we all know, timing was of the essence because the CARES Act at that time, it ran out of money. So IHS was a first responder to your financial health. Amazing. You know, we're really taking an approach to help you and your businesses. And so, hey, by the way, if you're a Facebooker, please friend IHS on Facebook. IHS continues in this whole thing of COVID to meet weekly with industry organizations. And as you see on the screen, we co-signed a letter to authorize Medicare coverage of telehealth services by audiologists. And IHS continues to advocate hearing aid specialists' involvement in Medicare policy. Speaking of Medicare policy.
Hey, can I just interrupt you for a second? Because I want to share for that as part of the COVID and our hearing aid specialist training program. Of course, we're required to monitor all the regulations and notify any of our supervising clinics about responsibilities. But in the process of WHS reporting back to the Workforce Training Board on our compliance, I talked to Joy and I went to the IHS site and utilized the documents that are there, sent those over to the Workforce Board, and they were absolutely amazed and thrilled that we had that resource and had those things in place and available to not only our training site members, but to everyone in the state. So kudos to you on that.
Oh,
but
thank you.
That was a huge part of, us maintaining our compliance as an organization and having resources available to all of our members. So if you haven't been to the IHS site, to utilize those and make sure that you are, compliant and meeting the requirements in your area, I strongly encourage you to do that.
Yeah, thank you so much for that, Sandy, because it's nice to hear that people are going to that site, and it has been useful. And to hear that from your compliance for the state, I think that's fantastic news.
I think the resource probably saved me at least a week's worth of work.
Oh, fantastic!
Not having to develop those documents and the resources. So those things alone are worth your membership
Yeah.
in IHS, like in a day, right?
Yeah.
Worth of value.
Oh, you're going to see so much more additional value as I go through this presentation of what IHS offers the member. And, you know, also for the business owners out there, that site you should be looking at, you know, utilizing your offices to make sure that your people are safe and your patients are safe. And so, Sandy, I really appreciate that because it's not often I get to hear, you know, the actual success of some of these
Oh, it's huge.
resources that we offer.
Yeah.
So thank you. Medicare policy. In September 2019, there was much talk about the expansion of Medicare to include hearing aids. And IHS, in September of 2019, we established 4 guiding principles for our approach to Medicare. And, you know, there was so much discussion of it. We knew it was going to happen. And we did these 4 guiding principles. Let's take a look at them. The first was hearing aid specialists be added to the list of Medicare providers to provide hearing evaluations and hearing aid dispensing services, including oral rehabilitation. And then coverage include both hearing aids and hearing aid dispensing services, including those consistent with the standard of care. Hearing aids be defined to, at a minimum, include capability for assistive device connectivity. And so, you know, Bluetooth or, you know, T-coils or whatever, loops, and that beneficiaries be granted the ability to top up to contribute to the cost of more advanced technology. So if Medicare has a basic hearing aid, like Medi-Cal does, right? But if Medicare has a basic hearing aid, let's say there's a $1,000 benefit, but they would benefit even more so with a better technology that we can balance bill. That would be it. And that hearing aid specialists and audiologists be treated equally as it relates to the requirements for and against a physician order or prescription prior to dispensing a hearing aid. Now, again, these guidelines were composed in September 2019. The following month, a bill was introduced in the House to expand Medicare. So IHS, we were ready. Our talking points were established. Or HR 4618 was introduced in October 2019. I know we talked a little bit about this in Coeur d'Alene, and this bill was added to add coverage of Medicare hearing aids under Medicare Part B. A funny thing how legislation works is that was what we call a standalone bill. It was a bill on its own to expand hearing aid or include hearing aid coverage. But rather than keep HR 4618 as a standalone bill, House Speaker Pelosi decided to add this bill to HR 3, which is a drug pricing bill to include hearing and dental, or eyes, ears, and teeth. Now, this is not uncommon to merge bills, as we watch this with OTC being merged into an FDA bill. I think it was an FDA funding bill. These merged bills were passed in a 2-week period, and amendments to the bills were limited. So since there were no amendments, basically there was no discussion, and that's why it only took 2 weeks to pass. And it passed mostly on a partisan vote with a 230 to 192 count. So what would HR 3 do? Remember, HR 3 is that drug pricing bill, but they threw in HR 4618. So what we're concerned about is it would expand services of audiologists and that could provide for Medicare. And it would cover hearing aids only for severe to profound hearing loss. Then it would reclassify audiologists from qualified audiologists to practitioner. Now, the bill with the drug pricing component and the addition of hearing aids would result in an overall $5 billion savings in a 10-year period. This is why they merged the bills. You're going to see why they had to merge the bills. It only made sense. The cost of the hearing aid benefit would have been $89 billion. And so if HR 4618 was going to go through the steps, it would never have been passed because it had an $89 billion cost to it. And so in this, they put it in the drug pricing bill to come up with a $5 billion savings over 10 years. So drug pricing, the drugs must have been taking a hit to save $5 billion while hearing aids added $89 billion to the cost. I don't feel sorry for drug makers. I just don't. Unfortunately, to keep the hearing aid costs down, it was decided that only one half of qualified providers would be allowed to dispense Medicare hearing aids, and that would be audiologists only. So here you have Congress who wants to expand Medicare and provide a hearing aid benefit, but then they want to limit access to that benefit. IHS continues to educate the House about our concerns with inclusion. Congressional staff has been receptive to IHS and concerns of access. Inclusion of hearing aids specialists and that coverage should include all of those with hearing loss and not just severe to profound. Regardless, this bill, according to Senate Majority Leader McConnell, is dead on arrival, and President Trump threatens a veto. So IHS continues the debate and advocates for a more inclusive process if this should arise in the future. So what's next? The Senate is next. The Senate has a few drug pricing bills of their own. Medicare expansion, hearing aids are not included. If a Senate drug bill were to pass, then the House version and the Senate version would have to resolve their differences. If this goes down, it's going to be a UFC match. And in the thick of it all regarding Medicare hearing aids, IHS will be in there. At this point, it's really unlikely Medicare expansion will pass, but down the road, if there's a change in party control, IHS will continue to be involved in the discussions. If you want to stay current on this issue, please visit our Medicare page. You can write that down if you'd like. So many resources, besides resources, things to help you, like with compliance issues. We're going to find out more compliance issues in your office that's going to talk about insurance companies and best practices. But we also have, links to keep you up to date on what's going on with our issues in the legislative and regulatory venues. IHS is also involved in international activity and working with the World Health Organization's hearing forum. IHS is helping to help drive awareness and create good policy for the prevention, identification, and treatment of hearing loss. IHS past president and currently Washington Hearing Society president Rick Giles represented the U.S. on a work group for the International Organization for Standardization for Hearing Aid Fitting Management Standards. Rick, thank you. That was a huge, huge commitment on your part. Amazing. Traveled the world too. Took time away from his office, and it was a big commitment. And a lot was accomplished. As you may recall, the National Academies of Science, Engineering, and Medicine produced a very influential report which helped start the OTC hearing aid legislation. Now NASM is looking to hold a workshop regarding insurance payments for hearing aids. And IHS provided feedback to the workshop organizers and is planning to sponsor the workshop and is pursuing opportunities to play a formal role. I mean, really all this stuff going on and nothing gets past IHS. You'd be amazed at IHS because we don't have the biggest staff. We really don't. We just have the most efficient people that are just driven and passionate about things that you do in your office every day. They want to protect you. The U.S. Preventative Services Task Force is considering making recommendations for asymptomatic adults age 50 plus to obtain screenings in primary settings. Now, why is this all important? Because this elevates the importance of hearing aid screenings and hearing loss as an important public health issue and will help identify people who need hearing loss help who may have otherwise gone untreated. And studies show that physician recommendations to get hearing aids absolutely drive people to decide to adopt. And if you are not working with local physicians in your community, you really should reach out to them and be a part of the process. It's so important. IHS specifically convinced the Friends of the Congressional Hearing Health Caucus to make this a priority at its planning meetings. And as a result, they took issue on and highlighted it during a congressional briefing. Now, all of our advocacy work is funded through voluntary donations. And to be sure, so that you know, this is not a PAC fund. We do not donate to legislators we work with. So this money, none of it goes into donating to some of the legislators. Donations made to the Advocacy Alliance are used to help IHS state chapters with regulatory and/or legislative threats that may restrict their ability to be part of the hearing healthcare process in their states. All of IHS's congressional activity and activity with the VA and FDA are funded by this Advocacy Alliance. So think about this. I mean, this is amazing that IHS passed a Fit to Serve bill, and then recently, the Senate Bill 785 unanimously, and we never put a single donation in any pocket of a legislator. IHS really just accomplished these amazing legislative feats through good public policy, something that everybody agreed with. That's amazing. It really is amazing. And so if you would like to be a part and join the Advocacy Alliance, you can either email me at don.tucker@verizon.net or private chat me and tell me your name and how much you want to donate. And we'll recognize you today and then make sure that you get all the necessary paperwork. So thank you for that. We now move out of advocacy and jump right into business tools and professional development. How are we doing on time? Pretty good? Looks like it. All right. Now, how do you plan to grow your practice in 2020 and beyond to meet the demand? Look at this. By 2034, it is projected that there will be more adults over 65 than there will be children. That would be an imbalance. Therefore, all you youngsters, you need to get busy. Now, considering those statistics, IHS would like to help you grow your practice and better serve your hearing aid wearers. So please consider some of these topics listed on the screen. The fifth bullet, I think this is really important, is expanding participation in managed care. That's a huge one going on right now, and it's frustrating for so many people. And it seems though every year when it's enrollment season, folks shop around based on their needs, such as, you know, I think I need new glasses, so I'm going to go with this plan, or I need new hearing aids, and this plan has a better arrangement, and or dental work, I'm going to go with this plan, and it's that eyes, ears, and teeth thing that we talked about earlier. So there seems to be a cycle that we're witnessing in the enrollment of Medicare Advantage plans, and we should ask ourselves, should we be part of that trend? And if we should, then we should consider growing our professional staff. And as you'll see in the next few slides, IHS is just ready to help you. IHS has a national apprenticeship program adopted in 2018 by the U.S. Department of Labor. We all know about this. It's a phenomenal program. This program, which relies on the training materials you are likely already using, is managed by state apprenticeship agencies. These agencies work with registered employees to help them recruit new talent, identify potential financial incentives for business owners, and plus, if you have a trainee using this program as they pursue their license, that trainee will get a certificate from the state upon completion, which is a great way to build your brand. And IHS will help guide you through the registration process. Just visit the second link to register, and IHS will follow up with you with the details. Now, the ILE test prep can help prepare you to pass the written exam. Here in Washington, ILE is the exam. Now, it's that time again. Please open your private chat and send these words to the monitor. Washington Hearing Society, or WHS, totally rocks. Washington Hearing Society, or WHS, totally rocks. You know, when you say Washington Hearing Society totally rocks, don't you want to hear a little Nirvana in the background? Mm-hmm. All right, so the premium platform of this ILE provides unlimited practice during the subscription period, inexpensive investment prior to taking the ILE, and it does not replace the actual distant learning course or hands-on training. Subscription fees are only $89 a month or $229 for 3 months. Sandy, are you guys using that at all? How's it going for you?
Pretty good. We have, I think we have 8 or 9 who are scheduled for their exams the end of September. And
Wonderful.
so it's something that I go over with each of them. I believe we have probably half of those who have registered for this, or purchased the subscription to use it for their license prep right now.
That is fantastic. That is fantastic.
And our test pass rate has been incredibly high. I think we're like 87 or 88% pass on the written exam the first time, which I would assume is much higher than the national average.
So is that that pass rate that's the 80%? Is that an improvement before the ILE was introduced? The test prep.
I think we'll have to probably track it a little bit longer. I haven't. I could go through our tracking and probably send you the information that would show. Let me work on that, because we gather all that data. I might be able to tell you and calculate the difference.
I would think it makes a difference. I would think it makes a big difference. Here on this screen, the trainer manual 3rd edition has been released, and the trainer toolbox. So you don't have to reinvent the wheel. You guys already know this. You guys use these. But this trainer manual, which comes with a brand new trainer toolbox, is an online system with handpicked resources and tips for the trainer. This new trainer manual also has expanded lesson plans, more measurable teach tasks, and milestone trackers after every 5 lessons, and an instruction video. Maintaining, did you know IHS maintains a national standards and guidelines for hearing aid dispensing? You should, and you can download this. This is so important because if a professional is not following best practices, he or she may be putting their license or practice in jeopardy and not providing the best potential care. Everyone needs to familiarize themselves with these critical recommendations. And so you can go download these recently released best practice guidelines on the above website there. If you want to write that down, you really should write that website down and download it and just kind of compare it to what you do in your office and see where you are with IHS's recommended guidelines. And if you practice in managed care and at other insurance companies, this is a must-have. And this comprehension is this comprehensive yet easy to follow guide arms hearing aid dispensing professionals, office staff, and business owners with the knowledge they need related to billing and credentialing. Oh, hey, we have some really good news coming up on credentialing, by the way. It also has pricing models and hearing aid dispensing super bills and pending claims and responding to denials. You know, that's the part that I hate the most, is getting a denial. Usually I go to the mail, I see that check from that, envelope from that insurance company. And if it's a little lighter than normal, I know it's a denial, because usually there's an EOB and a big thick check in there. And it's just wonderful. But, when you have to respond to a denial, the bummer is that, when you send off that response, it's going to be another 30, probably even 45 days before you get a response, hopefully a payment or even another denial. This has all that stuff in there. So this is really important to have. And this guide is free to members. And if you're not a member, this guide is $325. And so you ask, well, how much is membership? Well, it's $325. That's really good math. So either join IHS or buy the thing, but I think you should join IHS because we're seeing that there's so many other resources available. Now here's a new product. This is a brand new IHS product. It's the IHS Compliance Plan and Development Guide. This compliance plan is a formalized statement of a business's intent to act ethically and legally in its business operations in accordance with government laws and regulations, and is delivering patient care and services. So a compliance plan is often required by various health insurance plans for participation. I think we have to fill out attestation forms, compliance. Many of us have to do the fraud, waste and abuse, the FWA testing for Medicare Advantage plans. And this is just a really, and the fraud, waste, and abuse for Medicare Advantage plans, they want you to have a compliance plan in place. And so you should really have this and take a look at it. Now, if you participate in managed care, you should download this. And to download this, you have to be a member of IHS. And this compliance plan development guide is complimentary to our members. So visit the resources section of the IHS website. Now, if you're an IHS member, every quarter you receive this hearing professional. I love getting this in the mail, by the way. It has a lot of useful information, updates on IHS, and right now there's this recurring managed care series, which I think is really important in today's market. Now, here's another new product that we have, and this is fantastic. And there's one of them that I just can't wait to share with you. One of the focal points that they're going to offer here this coming week. Focal Point offers short virtual webinars that help develop your professional and business skills. And I'm really excited about the third one that's going to occur on August 27th. This is at CAQH, or Council for Affordable Quality Healthcare. Has anybody tried to utilize that in the past? Well, I did it. I did it about a couple of years ago, and they didn't recognize the hearing aid dispenser. Now they do. So this is actually a repository of credentialing data. And all these different health insurance companies, when they need to update your data, your credentials, CAQH holds all that information. So it's kind of a real centralized platform that, that all these companies are tapping into, and it makes it easy so you don't have to keep on re-credentialing with all these different health plans. It's such a hassle. I mean, I'm here in my office on Saturdays, oftentimes just to keep up the credentialing. It's a nightmare. It's a lot of work, and I can't wait to simplify it through this new plan. So IHS is amazing. There's a gal, Samantha, who does our insurance. She's chair of that committee. She's out of Wisconsin. She's absolutely incredible. So passionate about this. When I started an account with them a couple of years ago, again, they didn't recognize it. Now they will. So anyways, watch that focal point if you can. And you can always go to get some of these on demand after they've been done. So you can earn CEs on a variety of topics through IHS, virtual conferences, and to learn more, go to the listed website there. NBC, HIS, and IHS are now affiliated. The synergy between IHS and NBC, HIS is really starting to show. And this is one of the ways. I mean, my gosh, the marketing in this is phenomenal. NBC, HIS supports certificates in many ways. The organization has put on a strong emphasis on marketing toolkit for certificates. This includes a new website with a section designed just for consumers. In this section, consumers can use a search function to find a local board certified expert. And just launched is a new branding guide. This guide contains a marketing blueprint of helpful guidelines on how to properly use the designation and logo, and excitingly, templates for digital ads, press releases, blog posts, direct mailers, and even more. New templates will be delivered every other month to certificates. This way, they can keep their branding fresh throughout the year. NBC HIS just launched a new bi-monthly e-newsletter that will highlight useful marketing tools, resources, tips exclusively for the dedicated hearing healthcare professional. And we have new products that allow board certificates to promote their brand with their patients, just like the doctors do and the dentists. These digital badges can be used on websites, electronic signature lines, and social media, like LinkedIn, Facebook, Twitter. I don't know about TikTok. We'll have to find out. And this will help increase awareness of your board certification. When users click on a badge, they're taken to a landing page where they can see what skills are demonstrated by a certificate and what criteria is followed to earn and maintain certification. This information shows exactly what earning and maintaining the credential means to patients and referring partners. In today's technology-driven market, digital marketing is crucial for a company's success. So why should you become BCHIS? Because competition is a fact of life. So to help gain a competitive edge, being board certified will offer you an advantage. Board certification can increase marketability, inspire patient, client trust, develop career, and demonstrate commitment to excellence. Now here are just a few of the benefits IHS members receive. And IHS wants you to be the very best hearing aid specialist, and we have the educational resources to help. Are there any questions? Really? Throw something at me.
Hey, Don.
Yes.
Going back to the OTCs, have you or anyone else heard? I'm wondering if the major manufacturers like Starkey and Oticon and Resound and Phonak, if they're going to come out with their own version of an OTC?
Oh, I don't think they publicly said it, but, some of the reps that I've talked to said that they're definitely are not going to neglect that market.
Yeah.
And I think that really, if we want OTC out there, I kind of think that having our manufacturers doing it would be good because we would be part of the referral process. And so I think that that would probably be a good thing, but it's going to happen. I can't imagine that they're going to neglect it, but they just haven't publicly come out and said it.
Yeah.
It would be crazy if they didn't get involved in this. I mean, who knows this industry better? And what they'll probably be putting out there as OTC is stuff that 5 years ago we were fitting for a lot of money.
Yeah.
All those extra chips they have, who knows? It's going to be interesting. So any other questions? Thank you, Con.
I can add something to John's presentation. August 18th was the deadline for the FDA to release their proposed regulations. That has yet to happen.
Right.
August 22nd. We're not sure yet when that's going to happen, but expect to see an action item come through from IHS when that does for public comment.
Absolutely. We had the deadline passed this last week, as I mentioned, and of course they're late on this, and but it's going to happen, and it's probably going to happen this month. And IHS is going to be on top of this, and we'd have to provide public comments. And we really want to be on the same page when we go with these public comments because it'll really get the attention of the FDA. They really do read these comments, so it's really important. So thank you for that, Rick. Any other comments or questions? Okay, with all the changes in our profession, it is important to have your finger on the pulse. And you really do need to be in the know of the changes going on right here in Washington State and at the federal level. And to do so, please join Washington Hearing Society and the International Hearing Society. It'd be really nice to see you guys in person. I can't wait till next year. And so I have to say, just even in this format, it's really a pleasure to be here. And thank you for inviting me. On behalf of the International Hearing Society, we hope that first and foremost, you and your family remain safe and healthy. And as you continue to rebuild your hearing aid dispensing practice in your community and being a part of your community, may you be blessed. Thank you for your time.
Thank you.
Don.
Thanks, Don.
You
Thank
guys are
you.
awesome.
I would like to remind everyone that there is still an IHS membership on our auction site that has got one bid on it the last time I checked. So go if you're not a member of IHS, that's an excellent opportunity to join.
Thank you, Rick. Absolutely. And I hope it's a great event for you guys, and you guys make a lot of money. So thank you.
I think, let me just add, I think one of probably the things that I appreciate the most now with our training program and the relationship that we have with IHS, and the fact that we built the training program around the competency model, from IHS, and assigned our direct hours of, practical training, and really broke it down very specifically to the competency. I think when we talked before about passing rates for the tests, I think that has a lot to do with the success of the program, because the hours that the students are receiving as hands-on training are they're proportionate, right, to how they're going to be tested and the amount of time they spend in each of those competencies on a daily basis. But probably the thing that sticks out to me the most is the comments that I get from supervisors all the time as they take on students for training and they start to dive into the program, and then they say, oh my gosh, this really is helping me, and it's really giving me an opportunity to go back and reevaluate those best practices myself. And so I just encourage everybody that sometimes we learn best when we're training. And so it calls on us to stay at the top of our game. And it's just been a great experience. I think it's whether you're on the WHS board or you're simply a provider in our state, it's something that we can all be really proud of, and that the students that you are training not only are passing the exams, but they're staying employed. And you know, we're growing our pool of licensed professionals in the state, which is what we set out to do in the first place. So it's the partnership works because of you, but it also works because of our connection to IHS. So it's a three-legged stool, right? But so far it's we couldn't be more proud of it, and just with this success. And also to say that right now, I believe we have five of our 16 students that are enrolled in the program are working in audiology clinics now.
Wonderful.
So our program is also expanding and being used by audiologists in our state, which is fantastic. And we love to have them on board as well.
Absolutely wonderful. You guys have such a great program. I just think that it's what you guys have put together is absolutely fantastic. The students have to be a member of the association still. That's correct?
Yeah, that's actually part of the requirement through the Department of Health Board and the workforce training.
That's wonderful. I think, you know, that gives them exposure to how involved you are and what you do on their behalf. And I hope that has a good influence on them and helps keep them around to stay involved and be proactive. And then do all the where they're working, like do they have to be members of what Washington Hearing Society?
Yeah, the supervisors and the students both.
The supervisors, yeah. Thank you.
Yeah.
That is awesome. It's a great program that you have for the society, for the students, and just for the community. It's fantastic. So congratulations.
Yeah, well, the truth is it wouldn't exist, and we would never have been able to develop the program on our own. And the credibility of this program, it comes from IHS. It comes from the competency model, right? And the reach of IHS and the best practices and those types of things. So we take a lot of comfort in that, because we know that any questions that have come up from the board or workforce or anything like that about the requirements of our program or the credibility of it or the monitoring of it, we just stand on really solid ground that way.
You know, really a huge kudos to Joy Wilkins, who's in charge of professional development at IHS.
Oh, yeah.
She is absolutely amazing, and she is just on top of her game on every facet of what we need to be better professionals, better hearing aid dispensers. She is really incredible, and she's always thinking of new ways and better things that we can do. So we just have amazing
We
stuff.
try to remember to thank her, you know, and I'm in touch with her quite a bit, but whatever you can do to pass that along
Yeah.
back there, as well as we simply wouldn't have the program without them.
Yeah, she's wonderful. I mean, all the staff at IHS are really passionate about what we do. They're very knowledgeable. They're here to support us, and they're here to make sure that we have all the resources available to help our practices, help our students. So thank you for that.
All right, Don, thank you so much. If you could stop your screen sharing,